Hey guys, it's Nurse Gwenny. Let's talk about a really rare pathology, the R on T phenomenon. So the letters that we're talking about, that's part of the cardiac complex. Remember, we have our P wave, which is when the atria depolarize and contract. And then we have our QRS complex, is the depolarization of the ventricles and the ventricular contraction. And then we have our T wave, which is our ventricular repolarization. Now, it's important to know that that T wave is a really sensitive time. It's kind of like after you've had a tumultuous relationship and you're in a breakup period, and during that time, you're very sensitive to, let's say, a narcissist coming in and just wrecking your life, right? Because you're trying to heal from what you just went through. That T wave is the repolarization of the ventricles, and the heart is very sensitive or apt to any kind of interruption. Now, the R on T phenomenon is when we have some sort of electrical impulse that happens exactly at that time. And one of the common causes of it is when we have an undersensing pacemaker. And so the pacemaker isn't sensing that the heart is in that really sensitive time of that T wave. And if it introduces a new electrical signal, then that's going to cause R on T phenomenon, which usually kicks the heart into VFib, or ventricular fibrillation. Now, there is a mechanical version of this called commotio cordis, and that is when the chest takes a really big blow when the heart is in that T wave part of the cardiac complex, and that can kick a patient into cardiac arrest, usually a VFib arrest. So now you understand that R on T phenomenon and that really sensitive time when we have to protect the heart during that vulnerable T wave part of the cardiac complex.